Hi, good morning Alberta. My name is Charles Williams. I'm your invigilator for the OET speaking session on the 17th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Alberta Jamaica.
And what is your candidate number, please?
My candidate number is 210660002.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you contribute to the well-being of your patients?
When I am on duty, I try to do everything that I can to make the patients comfortable. I look after their needs and inform the doctors about issues they are facing. I also try to provide the assurance and empathy that the patient and his or her family needs, and above all, I complete each and every duty assigned to me in the best possible way.
What do you do when you don't know an answer to a patient's question?
When I start my shift, I go over patients' diagnoses and medications. If I'm unfamiliar with anything, I do quick research and learn what I need to know. It could be about signs and symptoms, prognosis, side effects of medications, adverse reactions, contraindications, etc. If I am still unsure, I ask a more experienced nurse or a provider. If I have questions about medication, sometimes I call the pharmacist and get clarification. And if I don't understand something, I don't try to guess. I'll contact my nursing supervisor or ask someone with experience. I don't let my lack of knowledge affect patient care.
Do you work well under pressure?
By nature, I'm very even-tempered, and that has given me strong foundational protection against stress. I also practice mindfulness and meditation daily, which has helped to further strengthen my mind. Additionally, I'm a runner, and I've found that jogging a few miles every weekend always helps me to clear my head and brace myself for the coming work week. And recently, I attended a symposium on workplace stress, which taught me about stress reduction techniques, such as taking walks during my lunch breaks to avoid burnout.
What would you do if you witnessed a fellow nurse administering a medication that wasn't ordered by a physician?
This is an interesting question, because it happened to me once. While on duty, I noticed a nurse administering medication, and I was sure the doctor had not prescribed this for the patient. I knew I had to stop the nurse from administering the medication until we were able to confirm that it had been ordered. I immediately approached the nurse and asked them to confirm that the medication was ordered on the patient's chart. Once they did this, they realized they had made a mistake. They were grateful for my intervention, and we both learned to double-check the patient's chart before administering any medication.
What are your professional goals?
I have several professional goals. A few important and most achievable professional goals in the near future are as follows: join the Emergency Nurses Association and become an emergency room nurse practitioner. The second is to earn my master's in nursing. I love teaching, and also I would like to guide young aspirants to become successful nurses and to have excellent careers. Thus I hope to mentor nurses and share what I have learned. I am excited about the opportunity to fulfill my goals.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Alberta Jamaica, one of the registered nurses working in this hospital reception center. How may I help you?
Hi, good morning. My name is Charles Willems, and my father is a patient here for dialysis.
Okay, for my better clarification, shall I know your father's name, please?
Sure, of course. His name is Willems Dickens. He is here for his first dialysis.
Thank you for the details. Now, what can I do for you today?
Nurse, as I have mentioned, this is the first dialysis for my father. And I am very new to this situation. So, it would really be appreciated if you could give detailed information about kidney failure, as well as dialysis.
Definitely, I can. It is my pleasure to make you understand your father's condition.
That is so kind of you.
You are welcome. Now, kidney failure is also called end-stage renal disease.
Okay.
The kidney's functions are to remove extra fluid and waste from our body, to maintain a healthy balance, and turn these into urine, to be passed out of the body.
All right.
But in your father's case, the kidneys are no longer functioning for the body.
Oh, I see.
When the kidneys fail, it means that they have stopped working well enough to survive without dialysis or a kidney transplant.
Oh, is it? If you don't mind, can you please let me know more about what is involved in dialysis? And what exactly it is?
Sure, why not? Dialysis is a procedure to remove waste products and excess fluid from the blood when the kidneys stop working properly.
Okay.
It often involves diverting blood to a machine to be cleaned and returned back to the body for proper regular functioning. Am I clear to you?
Yes, you are. But even now, I am not sure why he needs this thrice a week.
Charles, your concerns are quite reasonable. It is well known that increasing the frequency of dialysis improves the quality of life. When your father gets dialysis thrice weekly, the symptoms and complications related to his conditions will be comparatively less.
That's good to know. By the way, what about his chances of recovery?
Charles, I am really sorry to inform you that the chances that your father's medical condition is doubtful to improve. If he remains inside the treatment modalities, he can alleviate his symptoms and help them to be comfortable during his lifetime.
I understand your words, nurse. But I would like to know more about dialysis. Is it a painful procedure?
I appreciate your willingness to know in detail. During dialysis, some people experience muscle cramps, usually in the lower leg.
Okay.
This is thought to be caused by the muscles reacting to the fluid loss that happens during dialysis. But there is nothing to worry about. Your father will be continuously monitored during the procedure and managed appropriately if he experiences any trouble.
Great. Meanwhile, does this procedure have any side effects?
The most common side effects of dialysis include low blood pressure, infection in the dialysis site, muscle cramps, as I mentioned before, itchy skin, and blood clots.
All right.
If the symptoms are reported to the care team, they can provide your father with some lifestyle modifications, including diet. If you notice any symptoms of extremely low blood pressure, high blood sugar, blood clots, or spreading infection, your father should seek medical attention immediately.
Okay, I will make sure that he is monitored and cared for properly at home.
Good to hear that.
Nurse, I am heavily concerned that my father is 81 years old, and sometimes he is very stubborn. What would happen if he decides not to continue his treatment?
I acknowledge your concern, and it is worth noticing that, if your father stops his treatment, there are chances that your father will become very ill.
All right. I really don't want him to miss the treatment sessions. Definitely, I will take care of it and accompany him during the sessions.
Great decision. Meanwhile, do you have any other concerns?
Not really for now, and thank you for your information.
It is my pleasure.
That is the end of your OET speaking roleplay. All the best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.